Good evening. Backlash has been swift to Alberta's final report of the province's pandemic response. Danielle Smith's UCP government commissioned the task force. Among the list of recommendations is halting the use of COVID vaccines and other health measures. But as Terry Fikowski reports, those in healthcare and science fields say the report is biased and riddled with misinformation.
A 269-page report reviewing Alberta's COVID-19 response was quietly released online Friday, but it's drawing wide criticism from health and science experts.
That it contains misinformation, and we all know that misinformation is a huge problem right now, and people die because of it.
The $2 million task force was commissioned by the UCP government shortly after Danielle Smith took office in 2022. Among the recommendations is ending COVID-19 vaccines for healthy children and teens and full disclosure of potential risks. It also calls on banning mask mandates in the future.
What the report fails to mention is those measures worked. There are Albertans who are alive today who wouldn't have been if those precautions hadn't been put in place.
The report suggests doctors be supported to prescribe off-label use of certain drugs, criticizing what it calls a restrictive approach to drugs like ivermectin. But many health professionals say the report is often relying on bad data.
You know, a lot of the assertions that are scaring people are not really based on peer-reviewed journal articles, but on, Substack articles that misinterpret published data.
In a statement, the lead author, Dr. Gary Davidson, the former chief of emergency medicine at Red Deer Hospital, says he welcomes debate on anything in the report and, above all, asks for open scientific debate without an agenda. But critics say the task force was biased from its inception and made up of vaccine skeptics and those opposed to health restrictions, including Davidson, who accused the province of manipulating data about hospital admissions.
It is presenting a very focused and incomplete version of many facts. It is intersecting between science and politics, and that's always dangerous.
The opposition NDP says money could have been spent supporting the healthcare system now.
And we spent $2 million to throw taxpayers' money at every anti-vax extremist around the world.
The health minister's office says the government will review and consider the findings, but says no policy decisions have been made regarding the report yet. Terry Fikowski, CTV News, Calgary.
The Public Health Agency of Canada says it used an adaptive approach during the COVID-19 pandemic as new information became available, but maintains vaccinations remain as one of the most effective ways to protect against COVID-19, undergoing rigorous scientific reviews, quality standards, testing, and post-market surveillance.